How do I pick the right care service? Home care, home health, or hospice? Maybe you're staring at brochures and websites with terms like home health, home care, hospice, and your head's starting to spin. You just want someone to tell you which service fits you right now. If you've ever felt stuck between these options, you're afraid of making the wrong choice, this video is for you. In this video, I will simplify the difference between home care, home health, and hospice, when each one makes sense, what to watch out for, and how to decide based on your real life. I'm Dr. Anna Thomas. I'm a physician, TEDx speaker, and founder of Life Care Leadership. I've guided many families through these choices under pressure, so you don't have to feel alone in making this decision. I created this podcast, The Age of Caregiving, to give caregivers like you the tools, the structure, and the support to lead care with clarity. Whether you're navigating a new diagnosis or you're juggling care on top of everything else, know this, you are not alone. Please remember, everything that I share here is for educational purposes only. Always consult with your healthcare provider for personalized medical advice. And if you haven't yet, get my free care needs analysis training. It will walk you through what your loved one truly needs so your service choices are based on needs, not confusion. The link is down below. Let's talk about what each service actually does. Home care. So home care is non-medical help in your home. This includes things like help with bathing, meal prep, getting dressed, errands, cleaning, companionship care. You would hire or arrange for providers through a home care agency. This can help give you some breathing room and support for daily life needs. Home health care is a medical support sent to your home. It can include a nurse, a therapist, a medical technician that comes in to do skilled work, monitoring, wound care, rehab, IV, physical or occupational therapy. Home health care usually requires a doctor's order and often is going to be covered by insurance or Medicare depending on the situation. Now, hospice shifts the focus from curing and therapy to focusing on comfort. When someone is living with an illness that is no longer improving, hospice can offer symptom relief, pain control, emotional and spiritual support, all with dignity. It can happen at home or an assisted living facility. Depending on where you are, it can be offered in many different locations. Now, sometimes these services overlap. You could have a private home health aide while also using home health care or hospice care. And later, when hospice takes the lead for comfort becoming the priority, they may even provide some home aids. Let's talk about when each service makes sense. If your loved one needs help with everyday life, but not necessarily medical tasks, home care probably will cover your needs. If they need more medical interventions like monitoring or therapy, then home health care is essential. If their condition is not improving and we're shifting our focus now on comfort and emotional support and symptom control, then hospice can become a meaningful option. Now remember, hospice is not about giving up. It's about aligning the type of support that you need with your goals and your current needs. Here are some key questions to ask. What help do we need most right now? Is it medical? Is it for daily tasks? Or is it focused on comfort? Second, do we have a doctor involved who can help us understand which is the best option and then authorize home health care or hospice? Because for both of those, you do need a physician's order. The third question to ask is, what does our insurance actually pay for? Most insurances will pay for home health care as well as hospice. Many insurances do not pay for home care services, and you usually have to pay for that out of pocket. How much control and flexibility do you want? So this is the fourth question. Home care is often more flexible. You choose the hours and the caregiver, but the medical services tend to follow stricter schedules. The fifth question is, can we change it later if needs adapt? Start with one and adjust as needed. It's part of care leadership to evolve as needs are evolving. Here are some pitfalls to watch for. Relying on private home care when medical needs exist. You end up doing more medical tasks without the support that you need. The other pitfall is waiting too long to start any of these services, including hospice. That may mean missing out on comfort and support services that you really could benefit from. Another pitfall is assuming that one service will do everything. Oftentimes, they will stay within their specific areas. Hospice and home care, they're not going to cover cleaning, or companionship. And home care services aren't going to do medical tasks like wound care. It's important to understand what type of activities that service will provide. Here's a decision approach that you can try tonight. Think of it this way. Look at your current most pressing needs. Are they medical, personal tasks, or comfort-oriented? One service may serve as a majority of your needs, and start there and grow or shift later. If you're feeling stuck between options, then pick up my book, From Caregiver to Care Leader. It offers some tools and strategies to help you approach this question wisely. It's already helped many caregivers find direction, and you can find it on Amazon. The link is below. Remember, you didn't choose to be the one making all these big medical decisions under stress, but here you are, and you're doing exactly that, day after day. Deciding which service fits, that's a form of leadership. And every time you make a choice with intention, you are honoring your loved one's journey, and you're protecting your energy too. If you haven't yet, I recommend that you go back and watch How Can I Explain Caregiving Needs to Family and Friends? Because once you know which service you're choosing, you're going to want other people in your family to understand the why behind it as well. Remember, you are more than just a giver of care. You are a leader of care. This is the Age of Caregiving, and together we can lead it with strength, courage, and compassion.